Sounds good.
No, that's all.
Welcome, everyone. Welcome. Yeah, I think time is up. Welcome again. We just wait maybe 1 more minute for someone who isn't like again. Yeah. Okay, time is up. Again, let me say welcome to everyone. Hi. So today it's a sunny day and it's a beautiful outside. Welcome in our summer learning 2025. So this is like a good and then wonderful series of webinar. It will just go from August to September. And the title of this webinar is The Culture of Care, Embracing Roots, Elevating Practice. This is our first webinar. So the purpose of this learning series is to design for mental health care provider and care team, including community health worker, who support patient, family, and adapting the new care system, environment, or culture context. So we'll have a different session, and this session will just serve our mental health care system to empathy and understanding, fostering meaningful interaction across cultural backgrounds, strong trust and communication in clinical and community care setting. So this is a purpose of our webinar series. And this series will be more focused on building like practical relationship central to approach that strengthen communication, trust, and continuous of care across clinical and community setting. So we want just first to acknowledge something. This project is funded by the Maine Department of Health and Human Services, Office of Behavioral Health, through a pediatric mental health care access. The grant is supported by ERSA of the U.S. Department of Health and Human Services. So we want to let you know also that this learning series is developed and delivered by MCD Global Health in collaboration with the Maine Pediatric and Behavioral Health Partnership. So I just want to go a little bit about our housekeeping. First of all participants are muted. I think, Christina, you could check if someone is like muted. And then the webinar it will be recorded because someone who just registered, but they did not have a time because we are during our break time, we could send them a link. And then we have a live transcript from Zoom control. You could go in the 3 dots. You could check it if you want to see or you want to read. And then if you did not see that, you could just go directly. For someone, they already have the option of caption in the bar, both of your or your screen. Also, type any question or comment you have in the chat, and then Christina will just monitor that. If I did not catch up that question, Christina could just remind to me. And please use the question and answer, it's there. Also, at the end, the webinar will just request you to stay a little bit for 2 minutes to answer to our pool and then question. At the end, we'll have our evaluation. So this webinar, it's have 4 partners. The first one is Department of Health and Human Services. The second one is Men Pediatric and Behavioral Health Partnership. The third is MCD Global Health, and we'll have our great presenter from Men Initiative, who we call Men Community Health Worker. So this is a topic of the day. The topic of the day is team-based care, partnering with CHW. We have our four great presenters. Ben Homer, a project coordinator from Men CDC, and also he worked with Men Initiative. The second one, she will be a Bridget DeRico. She's a CHW. Also, she's project coordinator in charge of capacity building at Men Initiative. Our third will be Chrissa McViller. She's a CHW, also a co-chair of Men Initiative. At the same time, she's working as an outreach community health worker at Synchro Regional Center. And our last presenter will be Zakia Sheikh. She's an outreach training coordinator at MCD Global Health. Also, she's working with our e-learning team. This is our great presenter. I just give a stage to Ben. He could just start a presentation. Ben, you are welcome to start.
Great. Well, thank you so much for the introduction, Axel, and it's a pleasure to be with all of you today. Yeah, so I'll get us started here with the presentation. I want to say a lot of these slides that I'll be using today were actually developed for a learning lab module with Maine Medical Center's Center for Quality Improvement. And there were a couple other partners that weren't listed on who aren't presenting with us today, but helped inform the content. So just wanted to acknowledge that Brendan Prast and Maren Johnson from Maine Health's Community Care or Community Informed Care Initiative helped develop some of this content, and also Betty St. Hilaire from Maine General and the United Community Living Center had also assisted with preparing these a few years ago. So I just want to do a quick acknowledgement to those folks, but we can move to the next slide. So I'll kind of break the presentation today into two sections. The first part will be looking at the professional identity of community health workers and what the landscape looks like in Maine. And then during the second part of the call, we'll get more into the specifics of how you integrate community health workers within care teams. But to start us off, we wanted to do just a quick poll to get a sense of, for the folks on the call who are healthcare providers, are you partnering or working with CHWs within your healthcare team? So we'd love to see, where people are at in terms of their familiarity or their work with CHWs. So we'll give it a minute or two here to see if we get some submissions. And if you are a CHW yourself, you could probably put down a yes on there because you clearly are engaging and working, with healthcare teams. So, yeah. All right. And Axel, if it looks like we have a decent number of responses, happy to have you share results. Oh yeah, so looks like 100% of the people on the call at this point are either CHWs partnering with healthcare teams or healthcare providers partnering with CHWs. So that's exciting to see that this group is really pretty engaged in these sorts of partnerships. That's great. Great, well, we can move forward to the next slide. So to begin with, we'll start with kind of some level setting, and if you all have familiarity with the CHW model, some of this might be a little bit of a refresher, but I'll maybe move through some of these introductory slides a little bit faster, kind of given where the audience is at. But so CHWs have existed in communities and helping systems really for throughout human history. So they're not necessarily new, but they are newer to America's healthcare system, right? And the definition that we see on this slide was adopted by both Maine CHW Initiative as well as a steering committee within Maine DHHS. And it draws on definitions that have been used in Maine and nationally previously. And it's a lengthy definition. There's kind of a lot here, but some of the key concepts that you all are probably familiar with are that CHWs have a close understanding of the communities that they work with. So that could be things like shared identity, culture, language, life experience, a health condition, or some combination of those characteristics. And that understanding allows them to build trust and respect with the people that they work with. And one of the primary functions that CHWs serve is to act as that bridge between systems of care and the communities that they're working with. So those are a couple of the key points here. We can move to the next slide. This slide goes a little bit deeper. It's a resource that was developed by the National Association of Community Health Workers several years ago. They released this set of 6 pillars that really expands on the identity and origins and capacity of the workforce. So the first pillar they hold up is that CHWs are unique. This is a one of a kind type of workforce, but it's also important to acknowledge that CHWs have been recognized at this point by the US Department of Labor. They were included in the Affordable Care Act, and they were designated as critical infrastructure workers during the course of the pandemic. CHWs are community-based, right? So they're grounded in the communities that they work with, and the relationships they have with people are built on trust, respect, and dignity. They are also historic and diverse. So again, the history of CHWs goes back, many hundreds of years across the world, and there are also many different titles that CHWs use. And, interestingly as well, we see that workforce both nationally and in Maine tends to be majority female, and it also tends to be a majority people of color, and more diverse both than Maine's demographics and the US's overarching demographics as well. Um, we also see that it's CHWs are cross-sector, right? So they work across different systems of care to try to build capacity for patients in the communities that they work with, and they're also proven. So really at this point, there are many, many studies including control trials and systemic reviews and return on investment studies that have shown that CHWs play a really critical role in different types of systems of care, both in healthcare and public health. But despite that, it's also a precarious workforce. So CHWs are kind of among the lowest paid public health professionals, and there are occupational risks with this field, including things like secondary trauma and even exposure to communicable disease. We saw that a lot during the pandemic with COVID. And there's also not always sufficient state infrastructure for the profession related to things like recognition, workforce development, and sustainability. So I'd encourage people to look at the full set of pillars on NACHWA's webpage. We'll send out the slide deck after the webinar today. We can move to the next slide. Um, so this gets into a little bit of the ways that CHWs are different from other types of healthcare professionals. So CHWs are not typically trained to provide lots of direct medical treatment beyond, some basic types of screening tasks like measuring blood pressure. Um, CHWs also tend to relate to community members as peers rather than seeing them as clients or patients, and that allows them to break down barriers to trust and communication that sometimes exist in more traditional patient-provider relationships. CHWs also have experience-based expertise. So that's firsthand knowledge, again, of the culture, language, or context of the community, and they gain that through lived experience. And that's different than clinical knowledge, right, which most healthcare professionals gain through formal education. So there's a bit of a dichotomy there. Um, CHWs also engage with patients typically outside of the walls of the clinic, within community settings and home settings. So that also makes them, unique or different than some other types of healthcare professionals. And then the final piece here is that although, some licensed nurses, social workers, and foreign trained doctors choose to work as CHWs, most CHWs do not necessarily hold a license in a clinical profession. So that's another thing that makes them a little bit different. So we can move to the next slide. Um, the term community health worker is very much an umbrella for many different types of titles. The National Association of Community Health Workers, they did a survey in 2021 of 800 people working across the country, and they identified at least 97 professional titles in use. So there's really an incredible breadth and diversity within this field. Maine's CHW initiative has also done workforce studies as well several times. And this slide lists also some examples of titles that we see in use here in Maine. Um, it ultimately usually falls to the individual, whether or not they identify as a CHW, and also to the employer and whether or not they choose to classify their CHWs or their employees, I should say, as CHWs. But what unites and brings people together who are working in this field is, a set of competencies and qualities that we'll take a look at in the next slide, so we can move on. So this is another poll where we wanted to get a sense from people about, what are roles that you are familiar with that CHWs play either within your organization or your healthcare team. So I'd love to get a sense of some of the examples that there are out there. So you can either enter those into the Zoom poll that's popped up on your screen, or you can also add them to the chat. And we'll give a few minutes here to see what is popping up for people. And Axel, whenever it seems like we have a good number of responses, feel free to share those results. All right. Axel, does it look like we're maybe ready to share back?
Yeah, we have 70%. Did you want me to show 70 or
Sure,
yeah.
sure. Oh, it's all right. And I realized that we're not actually seeing the results. So, you know what? Let's go around the room and just see. For those of you that answered the poll, apologies. We can certainly share that back after the session today. But what were some of the things that you were putting in the poll? If you want to come off mute or share those in the chat, we'd love to hear.
Here at St. Croix, we have a school-based CHW who works with our behavioral health team. So most of her contacts are the students and working with the behavioral health providers. And I am the CHW that works in office and does the outreach as far as social determinants of health, working with patients for fuel, insurance, medications, housing, anything a patient might need.
Awesome. Thanks so much for sharing, Krissa. Yeah, and that was a cool word cloud. Thank you for pulling that up briefly there, Axel, and seeing a lot of also great examples in the chat here in terms of care coordination, reducing barriers, cultural brokering, being an advocate or a connector, thinking about the social determinants of health, connections with primary care, crisis response, resource connector, support and advocacy, recovery coaches. Yep, these are all excellent examples. Thank you all so much for sharing. And a lot of these we'll see, overlap very much with the standards that have been established for the field. So yeah, let's move to the next slide. Yeah, so this it's kind of a busy slide. There's a lot going on here, but this comes to us from the National C3 Council, which is a group that's actually seeking to define scope of work for CHWs. So they've proposed this comprehensive list, or several sets of lists actually, for people working in the profession. And what they've developed was informed through many years of work by CHWs and CHW subject matter experts from across the country. And excitingly, actually, they're doing now some new work and trying to kind of move further in building off of what they've proposed in the past, and actually doing a new round of town halls and community engagement events in the coming months. So that's exciting to see. Um, but it's important to also share that, many organizations in Maine have now endorsed C3. That includes MCD, Maine CHW Initiative, Maine Care, the DHHS Steering Committee. So these have kind of been embraced by a wide range of partners. And key to the kind of understanding of what C3 offers is that sometimes it's presented as a pyramid model, but basically CHWs have qualities, skills, and roles, and they all build off of one another. So the foundational qualities that CHWs have, those are not taught. They're usually gained through lived experience. And on this slide here, this is just actually a partial list of the qualities that have been recognized nationally. But then CHW will oftentimes then develop skills through training and professional experience that they use or that kind of build off of the qualities. So the middle column here, we see 11 skill areas that C3 has proposed. And they serve very much as the foundation of core training that is offered in Maine by organizations like MCD, as well as training programs across the country. And then together, CHWs use those qualities and skills, which together are kind of known as their competencies, to perform roles in both clinical and community settings. And in the right-hand column here, we see the set of 10 roles that the C3 Council has proposed. And I think an important caveat here is that CHWs may not use all of the roles as part of any given position. People do specialize, but we definitely encourage healthcare teams to consider what might bring most value to your organization or your team. And again, we can see based on what people have put in the chat that there's, I think strong alignment between the areas where CHWs are working in Maine and what the C3 folks have proposed. And there's also a link in this slide to the webpage. I would encourage people to go there and check that out. They actually have sub-skill, sub-roles, more specific examples that are provided as part of their resource section. So we can move to the next slide. So, we've gone to what kind of falls within CHW's scope. This slide here provides some examples of some things that might fall outside of a CHW's scope and may not always be the best use of their competencies. So these examples are not absolute at all. There's a lot of gray areas, and the boundaries between what a CHW does and other professionals do, oftentimes, it's not always set in stone, and it needs to sometimes be negotiated in consultation with, both a CHW and a care manager or a social worker or a nurse, to kind of figure out where the scope of one begins and the other kind of ends. So several things to keep in mind is that employers generally have flexibility in how they decide the C3 roles might be applied in their setting for a CHW. And in some organizations, an activity may be allowed, and in others, it may not. So we definitely see variance. It's also important to point out that CHWs may be capable of performing tasks outside of C3, but employers should always consider whether that's the best use of the CHW's competencies or skills, right? And some duties also might require additional qualifications or training outside of core competency training. And CHWs oftentimes do sometimes hold other types of credentials for other roles within the healthcare system. So in your particular team, that might be an appropriate step. And then the other thing I'll just mention is also the organization's size and capacity sometimes can also impact this in terms of what gets delegated to CHW. Sometimes in smaller organizations, kind of everybody shares the load of administrative tasks, even though that may not be their primary role. So that's something to acknowledge. So one of the resources we're going to provide to you today is actually a larger document that goes much more in depth in with these examples, but I'll kind of briefly move through them here relatively quickly. So, the first thing I'll mention is that is the clerical tasks example. So, generally speaking, CHWs are not office assistants, right? So kind of making copies or working the front desk or answering kind of the main line at the office may not be a good use of their competencies. They might perform tasks to support an individual or a family receiving services that are administrative sometimes, like they might make a phone call about an appointment or document an encounter in the computer or make copies of some education materials. As long as it's tied to direct work with patients, we generally see that as appropriate. Um, the next example is medical interpreting. Whether CHW provides interpretation really varies by program, but it's important to acknowledge that interpreting is its own set of skills and has training and certification that's required. So just because a CHW speaks the same language as a client, that doesn't mean that they're necessarily trained or certified to interpret. And it's also important to acknowledge that sometimes it may not be realistic for someone to interpret while also doing other important roles like health education or patient advocacy. So there's a balance there. In terms of clinical skills, again, we had touched on this a little bit earlier, but most CHWs do not have formal training to perform lots of clinical tasks. Again, some CHWs have credentials or training in roles like a medical assistant or a CNA. And again, it'll be up to that employer to consider, what's the best use of that person's credentials or skills within their care team or organization. Um, Clinical recommendations, CHWs are not qualified to triage, diagnose, or treat patients. And it's also important to acknowledge, they're going to need support from the care team to be able to communicate things like diagnostic results or treatment plans to patients with support from clinicians and RNs. Driving patients, this really varies a lot by program, but you're going to have to consider things like insurance liability and patient safety and CHW safety and time if CHWs are going to be transporting patients directly. Um, Behavioral health therapy, CHWs are generally not qualified to provide formal counseling. They do provide informal emotional support, but generally speaking, if a patient has an acute untreated mental health diagnosis, it's best that they have that addressed by a behavioral health professional. Um, and a couple other examples that we see here, immigration and legal representation. CHWs certainly work with individuals that are impacted by the immigration and criminal justice system. But, generally speaking, it would be better for them to connect individuals to legal aid programs than serving as direct legal advocates themselves. Activities of daily living. Generally speaking, it's not the best use of a CHW's time to be assisting with things like, bathing an individual or cleaning a home. Those CHWs do work with caretakers and people with disabilities to help connect them to personal support services for professionals that can provide that level of support or care. Um, and then the final area is insurance forms and prior approvals. So many CHWs do assist individuals with enrolling in health coverage and other programs to address financial barriers, and that can include things like completing paperwork. But as a rule, an organization should consider whether completing that paperwork is that supporting the specific needs of an individual or a family that CHW is working with, and if so, then that makes sense. But we should avoid kind of assigning CHWs large volumes of kind of clerical work because that's generally not the best use of their skills. So um, yeah. So again, I'd encourage people to take a look at that resource after the call. I know that was kind of a lot of information I just went through there, but that's a kind of brief overview of some examples that we think about for boundaries. We can move to the next slide. Um, so there are other professionals that may perform some of the roles, same roles as a CHW, and that can include people like case managers or social workers or interpreters. So as a result, it oftentimes falls to teams to determine, where is there overlap and who should specialize in what type of duties or responsibilities. And there's not going to be a one size fits all approach. The roles are going to look somewhat different in different organizations. But one thing we can offer to people is an example of how one health system approached that question. So this is actually a resource that was created again by Maine Health's Community Informed Care Initiative, where they created this chart that shows a list of roles and responsibilities for different job descriptions within their health system. And then they went through and actually checked off, who does what and where is their overlap and where are their differences. So that's another resource we'll provide to you all today, is actually a larger version of this document that's blank. And I would encourage people to use that and adapt that for their own purposes as you're looking to map, what the roles of a CHW might be within your organization compared to, a case manager, an interpreter, a social worker. You could even add other types of professionals like a medical assistant or an RN in there and add additional roles to consider. But again, I think the key takeaway here is if a CHW is going to be successful in the care team, the whole team really needs clarity on what the CHW's scope is. That's kind of step number one to integration. So, um, yeah. So we'll move now to the next slide, and this is actually going to be an opportunity for Zakia to talk a little bit about a patient case that she had several years ago, and it is a nice highlight for some of the differences between her role as a CHW and those of other members of the care team. So I'll turn it over to you, Zakia.
Thank you, Ben. All right. Are we having that slide pulled up?
Yeah, Axel, are you able to get the slide back up for us?
Yes, for Zakia. I just want to give you your slide number 17. Yeah.
Awesome. Thank you, Axel, and thank you again, Ben, for that introduction. So this particular case scenario or patient scenario follows an immigrant mother of a 30-year-old male patient with cerebral palsy, and they've been living in a low-income housing unit for the last 20 years. And so for those throughout the 2 decades that she's been living with her son in this unit, they've been facing significant challenges, specifically when she's assisting her son with bathing. And that's because they don't have an accessible shower, and that's resulted in a lot of mold growth and just an overall unsafe condition in that bathroom. They've had a couple slips and falls. And so this mother had been struggling to receive assistance for housing modifications due to language barriers. This was a woman from Somalia, and she had limited English capacity, as well as she didn't have a whole lot of access to her case manager. And that's due to the limit of billable hours for case managers per client. So experiencing frustration and then, of course, emotional exhaustion, the mother had reached out to a community health worker and through a community member and was connected to our organization. So upon receiving that referral, I began working with the client at a community-based organization. And this client was a new mater needing support and resources from a trusted member of their community. And so the client was able to provide more information about exactly what it is that she needed. So she was requesting a walk-in shower, including a handlebar and some new flooring for her bathroom. She specifically wanted to stay in that unit. She didn't want to uproot her life and move out. So I began by conducting some initial research on disability rights. I wasn't entirely sure what the process was like for something like this. I'd never dealt with a situation like this. So I started out by researching housing modifications and tenant rights and different avenues for assistance. So after that, I ended up reaching out to the New England Americans with Disabilities Center to get some resources for reasonable accommodations under the Fair Housing Act. So that was really a pivotal point for me, learning about the legal aspects of what sort of rights and protections that this client had, and specifically for individuals with disabilities. And so I began to explore potential funding sources for these home modifications as well. I was looking at public and private grant funds that would help alleviate some of that financial burden of renovating an entire bathroom. And so from the very beginning, I was engaged with the client and offering emotional support with cultural sensitivity and empathy, ensuring that the mom, she felt understood and valued. And so it's important to kind of highlight that in that approach of offering empathy, understanding, cultural sensitivity, all of that, it was really central to building that relationship. And so unlike normal sort of the common counseling that's provided by therapists and LCSWs, clinicians, that mostly involve like formal therapy sessions and clinical interventions, the sort of informal emotional support offered by community health workers is more rooted in that trust building and building a relationship with the client. So, recognizing the importance of addressing the mother's mental health needs, right alongside what she was requesting, her child's requirements. I try to provide additional emotional support tailored to her specific circumstances. So a lot of that had to do with figuring out how long she had been in this situation, and providing that sort of care and support from an understanding lens. And so I continue to work with this client, as well as with the case manager, to create a plan of action. And that included her advocating on her behalf with the housing authority, who informed us that they would be open to that housing modification. They just wouldn't be paying for it. So in turn, that became us applying for grant funds, and just creating a structure of support for her throughout this continued process, because it was a process. And that support included coordinating language interpretation and any sort of additional assistance that she might have needed. And so the role of a community health worker in this particular scenario, it's multifaceted and it's distinct from other health professionals like case managers, social workers, and interpreters. But it does complement their efforts in a patient-centered care team. So the community health workers intervention, it's rooted in a profound understanding of the culture of the community and a prior understanding of that client. And it enables a unique approach to healthcare that addresses social determinants of health in a more comprehensive way. So, in contrast to the case managers who navigate logistics of patient care within the constraints of a healthcare system, CHWs often serve as advocates and cultural brokers, and they try and help bridge the gap between the clinical services as well as the community needs. So, in this particular scenario of an immigrant mom and her son, a community health worker not only identifies the practical needs, but provides culturally sensitive emotional support that might not be fully addressed by social workers or interpreters. So, social workers might focus on the psychosocial aspects, and the systemic barriers that are faced by the patient, whereas the interpreters are facilitating communication and they don't engage in advocacy or direct support. Community health workers, however, they embody both of these roles simultaneously. They advocate for patient rights, they're out seeking community resources, they're trying to ensure the patient's cultural and emotional needs are met. And the ability also to conduct research, right, on disability rights, housing modifications, going that extra mile really exemplifies the proactive and resourceful nature of the CHW role. So by reaching out to the New England ADA Center, I was working to ensure that the client's rights were upheld. And that really navigates, the complexities of legal and housing systems that other care team members might not have the capacity to undertake. And throughout this client's journey, we remained a consistent figure of support and trust for her, And that included addressing social determinants of health, like safe housing, language access, financial stability, getting her direct needs as well. Those are all extremely vital for this client's overall well-being, and not just in this particular scenario, but her other needs as well. And so we, in collaboration with the case managers, utilizing interpretation services as needed, the CHW, or me in this case, really helped to create a multifaceted support network tailored to this client's unique situation. So in summary, it's, the CHW in this scenario, they're leveraging their role to address the broad aspects of this patient's health and well-being, reflecting on the significance of integrating CHWs into healthcare teams. CHWs work to promote health equity, by offering a deep understanding of the cultural nuances that might not be apparent to a lot of different folks, and just providing continuous support and advocacy. And that's all really instrumental in navigating the social determinants of health. Um, so I thank you for letting me share this particular case, which was a really pivotal moment for me as a community health worker, and understanding how important a role like this is, and how we can work together with other health professionals in supporting community members. So I appreciate you for letting me share, and I'll pass it back to you, Ben.
Yeah, thanks so much for sharing, Saki. It's a really an amazing case. Yeah, we can move to the next slide here. I am doing a time check and realizing I think I didn't do a great job of staying on track for the first part of the session. So I think actually for the next several slides here, we're going to move through these fairly quickly. I'll just acknowledge the Maine CHW initiative has actually done some survey work of the profession across the state. And these slides will be available to you after the presentation today, but they do provide a little bit of a snapshot in terms of what we see. So you can actually move to the next slide, Axel. We see CHWs are working with many different types of diverse populations across the state in all Maine counties, and of particular interest here, close to 40% CHWs, report working with individuals or communicating with community members in languages other than English. And I know the focus of this webinar series is, working with new Mainers. So let's move to the next slide. And actually, I'm going to have Bridget Derrico from the Maine CHW Initiative come on briefly here and just talk a little bit, just a few minutes about their network and what they offer.
Thank you, Ben. Thank you for the introduction. Very excited to share a little bit about what the initiative does. I see a lot of familiar faces, so probably mine isn't new to you either. So the state network of CHWs and allies, we've been together probably since 2013, and it is currently led by an advisory board of 7. We have 2 co-chairs. And then also, myself as the staff member, Ben assists as well. And then we have all of you, our allies, right? A lot of organizations and healthcare providers, and then all of the CHWs. Currently, our list is at like 525 individuals. We offer, and why become part of the initiative, but we offer lots of things like the peer support group, workforce development, leadership opportunities. And some of those might look like, in advocacy, we also provide a lot of resources and possibly some job opportunities for the initiative. But honestly, mainly we're here to support the CHW workforce and to push the workforce forward in certification and education and training and leadership. So all of you feel supported, or all of the CHWs and yourselves feel supported. You can learn more about our initiative on a website. Ben has it listed, has it listed here on the slide at the mainchw.org.
Great. Thanks so much for sharing, Bridget. Yeah, and we'll move through this slide also rather quickly. I think important thing just to acknowledge is that there's no national credential or certifying body for CHWs, so each state handles certification a little bit differently. It's important to acknowledge that certification doesn't currently exist in Maine, but as Bridget mentioned, the CHW initiative is actually working to develop a model right now that might be available and rolled out as soon as the beginning of 2026, which is really exciting to see. But also important to acknowledge that up until this time, when CHWs complete training in Maine, they receive a certificate of completion of training, and that's different than being certified to perform a scope of work, which is really what the initiative is working to build in the future. So we can move to the next slide. Um, so the next part of the presentation, again, will be more focused on integrating CHWs within healthcare teams. We can move to the next slide. And actually, Axel, we can skip this poll again, just in the interest of time, just because I want to make sure we have enough time for Chris's case, so we can keep going here. So in terms of team-based care, this is probably a concept that many of you are familiar with, but it's been shown to be effective, right, for managing cardiovascular disease and a range of other health conditions. And there's strong evidence now of including CHWs within team-based care. This slide actually lists a number of the strategies that CHWs can contribute to, and actually the case that Krista will be doing later on will touch on some of that in terms of support around medication management and adherence. So we can move to the next slide. So, CHWs, in terms of benefits for, the healthcare team, understanding their value, one way we can think about that is through a concept that's been around for a while, which is the quadruple aim. It used to be triple aim, but, CHWs can help healthcare teams achieve kind of all of the goals in this area in terms of improving population health by addressing community needs and improving the patient experience by making care more responsive to patient needs, improving utilization of services and outcomes to contain costs, and also helping to support other members of the team with demands to improve their well-being. So we can move to the next slide. This slide provides some examples, and actually, you might have to click again, Axel. I'm not sure if they're popping. Yeah, yes, you'll have to click, I guess, a bunch of times for those to pop up. These are examples of duties that a CHW can perform within a healthcare team, and these would typically be, assigned to them or delegated to them by a supervisor or a clinician. But again, by taking these on, it can help other members of the care team practice at the top of their license. And CHWs are also usually able to deliver these in a way that's responsive to the community that they're working with. So we can move to the next slide. In terms of screening for social determinants of health, this is becoming an increasing requirement for healthcare providers. And we see in this slide examples of how CHWs can help support the larger healthcare team by facilitating screening through a whole varieties of ways. And CHWs are really well positioned to do that because social needs are like their primary focus area. They have a lot of expertise in terms of the resources that exist that can address them, and addressing them can be time consuming. And CHWs oftentimes have the capacity to be able to spend time with the patient to troubleshoot those sorts of issues. And then they also have trusting relationships, which makes it easier to ask those sort of difficult questions that oftentimes go along with this type of screening. So we can move to the next slide. Financing here. So increasingly, the Center for Medicaid Services is recognizing the value of CHWs, and we see that there are new payment models that are emerging. I won't go into those in depth, but at this point, both Medicare has released fee-for-service codes related to CHWs, and MaineCare, through their alternative payment models, are allowing per member per month payments to be used for CHWs as part of the care team. And I think an important thing to note here is within both models, revenue for CHWs ultimately flows through the healthcare team or organization. So to take advantage of those sorts of financing options, integrating CHWs within healthcare teams is a requirement, and is necessary. So yep, we can move to the next slide. This is an example of a workflow from Maine Health's community care community informed care initiative, once again, of how their CHWs interface with patients. Workflows look different at different organizations, but this is just to give you a taste of how one organization kind of approaches their workflow. So it starts with the CHW receiving a referral and meeting with the patient, and then working through things like the patient's care plan, what sort of SDOH screening has been completed with that individual, and then trying to set goals with the patient that are realistic and centered on both those social needs, but also things that are within their care plan, and helping the individual build capacity so eventually they're able to navigate the health system with the support of others, and the individual can be eventually discharged after a period of time. So so that's kind of what this workflow model looks like. We can move to the next slide. Um, in terms of settings, um, we see that CHWs are employed both by healthcare systems and large and small, but they're also employed by many other types of organizations. So I think it's important for healthcare providers to know that, you might partner with a CHW in either arrangement. They might be a member of your care team, but they could also work for another organization, like a community-based organization, and they're still a care team member in that case. It's just the relationship looks a little bit different. Um, Also important to acknowledge here, and I think this was already reinforced through prior slides, but CHWs are able to engage patients in their environment, and that's one of the things that makes the model so powerful in terms of being able to bring back important information to the rest of the care team about individual and community needs. And also important to acknowledge CHWs are very flexible. They are oftentimes working in multiple settings during the course of even just one day. We can move to the next slide. Um, this slide gets into some strategies related to integrating CHWs within care teams, that was actually released recently by the National Association of Community Health Workers. But some things for you to all to consider is that when you're hiring individuals with lived experience, you might need to adjust things like hiring practices to make sure you're screening for the right characteristics. Um, We've already talked a lot about role definition and how important that is. We've also talked about how providing evidence-based training and professional development for CHWs is really critical as members of the care team. Um, Fostering partnerships with local organizations is oftentimes critical. CHWs cannot fix all the issues themselves, right? They need relationships with other organizations and partners to address patient needs. Um, and then the last couple items here are engaging CHWs in the planning, implementation, management of programs is oftentimes makes them much more successful. And then the last piece is around documentation. And some health systems now are moving to have CHWs actually document their work in the electronic health record. Sometimes that's not feasible, but even if CHWs are not going to have direct EHR access, it's really important for the healthcare team to figure out how is what they do with patients going to make it back into the patient record, so we can show the evidence of their impact and effectiveness, and for things like billing, which is now an option in some cases. So we can move to the next slide. Um, this slide covers some additional considerations for healthcare organizations that might directly be hiring CHWs, and some of these certainly overlap with previous slides, but a couple of things I'll hold up here and highlight just are that you need to consider what supervision and oversight will look like for the role, and what sort of support the CHW will need around data collection and referral management, those sort of things. Oftentimes you'll need to develop things like guidebooks or manuals and workflows that are specific to a community health worker, and that can include within the AHR. And you'll also have to think about things like metrics in terms of what are you tracking related to the CHW's work, what's important to your organization, and what demonstrates their impact. We can move to the next slide. Um, and then the final piece here is just reinforcing the importance of communication between the CHW and other members of the care team. This slide provides a wide range of options that you could consider in terms of how the CHW is checking in with other members of the care team. This was actually developed by Maine General. CHWs at that healthcare organization, they actually use all of these different options for communication. So you'll have to decide, which ones might be the best fit for your program. So I will now turn it over to Krissa. So she has an opportunity to cover her patient scenario, which demonstrates her role within the care team. So.
Hi, good afternoon. So this was probably one of my first patients that I encountered when I started as a CHW here. Perfectly healthy patient prior to getting COVID. She was in her early 70s, but she came down with some major complications after with breathing. And she was prescribed the medication Breztri to help her. So she got the prescription, went to the pharmacy, and they told her it was going to be over $300. So she was like, I can't afford that. So she called back to the health center and told her provider that she couldn't afford it. Her husband is a diabetic and had a major cardiac event. So he was on a lot of medications. Sometimes she wouldn't pick up her medications because she felt his were needed more. And so the costs were just coming in. So we worked with her. I worked with a drug rep to get the medication for her here as samples at the health center, and made sure it was available. Like I said, this was kind of my first case. So I asked the drug rep, was there anything else we could do for her? She's not going to be able to afford this. And that's when they let me know about their patient assistance program for the medication. So I got the patient to come in and we talked about it. And like I said, we found out there was more high cost medications. And just discussing this with her and, letting her know that there was help out there for one thing kind of led to a conversation and finding out that, with their income, they qualified for extra help. And just kind of building the relationship with her made her comfortable wanting to apply for this and get the help she needed. So we were able to not only get her the patient assistance for her medication, but we were also able to, down the road, get them signed up for the Medicare Savings Program. And so now they are facing no premiums, no deductibles, low copays for their medications, and they're both able to get it. So one big thing I've learned is if you're in a health center and your health center doesn't let drug reps in, you should advocate for that, because without my drug rep, I wouldn't have been able to help this patient. I wouldn't have been able to have the medications for her. And I probably don't know where she would be right now as far as breathing. And she's very grateful for this. Every time she comes in, she thanks me over and over. So, and her provider was very shocked that this was out there. Sometimes the providers don't even know that we have this out there for our patients. So that's my story.
Wow.
Thank you so much, Krisha, for sharing. And yeah, again, we have a resource slide here. I apologize, folks, for in terms of time management, not building in a lot of time for questions. We just have a minute or so left here, but again, feel free to reach out to me or other members of the team if you want to have a follow-up, or to post any questions in the chat. But just want to thank everybody for the opportunity, and also to our co-presenters who all did an excellent job. So
Yeah, thank you so much, Ben, for your great presentation. Could you give a reaction with big upload for our presenter? And then after that, I will just handle quickly to my colleague Melissa. She could just present us a little bit about the main pediatric behavioral health, and then just stay a little bit at the end for 2 minutes. Just Melissa, you have a stage.
Sure, thanks, Axel. So just wanted to mention that this webinar series is in part sponsored by the Maine Pediatric and Behavioral Health Partnership. So this is our website here. We offer psychiatric consultations for pediatricians and PCPs and their pediatric patients. And so they can find out more information here or call our consult line. And we also offer other educational opportunities, which are on our website, but our next in this series is next Thursday. And it will be on building trust in care and strengthening patient engagement. So we hope you join us next time during this time frame.
That's good. Thank you so much, Melissa. And then could you just answer this quick question to ask this couple of questions, like 5? Take just 1 minute and a half. It will just go very quick. And then at the same time, we want just to leave this reminder here. So would you just register? We have multiple series. Another one, it will be on like Melissa say, next Thursday. And after that, we have another Thursday on 2021st. Another one will be on August 28th. And another one will be in September 4. So at the end, I think Christina will just give us more detail, maybe about in-person event. But right now, we're still in our webinar session online. So I think we already have 14 who just already answered. We still just wait 1 person. Okay, it's 100%. Thank you so much for your answer. And then we just go over 2 minutes. So Christina, I don't know if you have any word you could just say about, I don't want to keep you quiet all meeting. So if you have a stage, you could say hi or something to.
No, thank you so much, Axel, and thank you everyone for joining us as we kick off this webinar series, this summer learning series. And so we hope to see you in the future ones. I will say that we'll send out the presentation slides so that you can get the presenter's contact. There'll be the recording available as well. And we'll follow up with a PDF of all the registration links for the future sessions. And so we hope to see you in the next few weeks as well. Thank you, everyone.